Smoking kills 8 million people a year. But if users need more motivation to kick the habit, the pandemic provides the right incentive. Evidence reveals that smokers are more vulnerable than non-smokers to developing a severe case of COVID-19.
At the same time, the WHO has acknowledged some reports of airborne transmission of the virus, but has stopped short of confirming that it spreads through the air. Some outbreak reports related to indoor crowded spaces have suggested the possibility of aerosol transmission. Earlier, the WHO was speaking in Geneva, Switzerland, at a live media briefing there. Let's take a listen to what they said on that issue.
Aerosol transmission is one of the modes of transmission that we have been concerned about since the beginning, particularly in healthcare settings where there are known to be these medical procedures called aerosol generating procedures, where we know that these droplets can be aerosolized, which means that the particles can stay suspended in the air for longer periods of time. In those situations where the health worker is actually carrying out those procedures, and for people working in those areas, we recommend airborne precautions, which is a certain type of personal protective equipment for health workers. Outside of healthcare settings, there is the possibility that there could be aerosolized particles in specific settings like indoor settings where there are crowded conditions, where there's poor ventilation, and where people are spending prolonged periods of time. And so what we've seen is that there are some outbreaks that have been reported in these closed indoor settings with poor ventilation, which include what you had mentioned, the nightclubs, which have included choirs, fitness centers, where airborne transmission cannot be ruled out.
So back here at home, the